Welcome to today's video where we're diving into the world of hospital cleaning. If you're gearing up for an interview as a hospital cleaner, you've come to the right place. Let's get you ready by exploring some common questions you might face. To start, let's talk about teamwork, which is crucial for maintaining cleanliness in such a dynamic environment. Can you share an experience where you had to collaborate closely with a team to keep a large area clean? This question helps interviewers understand your ability to work as part of a team, a vital skill in hospital settings. Here are some tips for crafting your response. Choose a specific team project or task to discuss. Clarify your role and responsibilities in the team. Describe the communication and collaboration methods used. Highlight the successful outcome and any improvements made. Reflect on what you learned about teamwork and cleanliness. Let's look at an example answer to illustrate this.
During a hospital renovation, our cleaning team was tasked with deep cleaning an entire wing. I coordinated with my teammates to assign specific areas, regularly communicated about our progress, and we finished ahead of schedule, ensuring a pristine environment for patient safety.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for hospital cleaner. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Tell me about a time when you had to quickly adapt to a sudden change in your cleaning schedule. This question assesses your adaptability, a necessary trait for dealing with the unpredictable nature of hospital environments. Consider these tips while forming your answer. Recall a specific incident where your schedule changed unexpectedly. Explain how you quickly assessed the new situation. Describe how you prioritize tasks to remain efficient. Share how you communicated with your team or supervisors. Conclude with the positive outcome or lesson learned. Here's an example to help you shape your response.
I was scheduled to clean the surgical wing, but a last-minute procedure required us to move to the pediatric area. I quickly assessed the necessary cleaning, prioritized areas heavily used by children, and ensured communication with my supervisor and team. We completed the tasks efficiently and on time, which taught me to always be prepared for changes.
Describe a situation where you had to prioritize your cleaning tasks in a busy environment. Interviewers are looking to gauge your ability to prioritize effectively, especially during peak times. Here are some pointers to guide your answer. Identify and focus on the busiest areas first. Communicate with staff to understand urgent needs. Use a checklist to ensure all tasks are covered. Remain flexible and ready to adapt to changing priorities. Stay organized to maintain efficiency and speed. To give you a sense of how to answer, here's an example.
In my previous role, I worked during peak visiting hours. I prioritized cleaning the waiting areas first, as they received the most traffic. I checked in with the nursing staff to see if there were urgent cleaning tasks and adjusted my schedule to ensure all high-traffic areas were spotless.
How would you handle a situation where there's a spill in a patient waiting area? This situational question evaluates your ability to respond to emergencies and maintain safety standards. Keep these tips in mind when crafting your response. Stay calm and quickly assess the situation. Ensure the safety of patients and staff by cordoning off the area. Use appropriate cleaning materials and follow safety protocols. Inform your supervisor about the incident. Document the spill and actions taken for future reference. Here's how you might address such a scenario.
First, I would assess the spill to determine its nature, then cordon off the area to ensure everyone's safety. I would then use the appropriate cleaning solution to clean the spill while following safety procedures, inform my supervisor, and document what happened.
If you notice an unsafe condition while cleaning, what steps would you take? This question checks your awareness of safety protocols and your proactive approach to hazards. Here's how you can structure your answer. Immediately stop cleaning in the area to ensure safety. Assess the situation and identify the nature of the unsafe condition. Report the unsafe condition to your supervisor or designated safety officer. Use signage or barriers to alert others about the hazard if possible. Document the unsafe condition if required for safety protocols. Consider this example when thinking about your response.
I would stop cleaning in that area and assess what the unsafe condition is. Then, I would report it to my supervisor immediately and use caution signs to warn others.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.